Kidney transplantation. Kidney transplantation is a curative treatment of kidney failure, end-stage kidney failure. This treatment, even though experimentally was done in early 1900s, the final successful transplant was done in 1954 in Boston. In a pair of identical twins, one gave the kidney to the other. Since then, this treatment has been perfected very well. Now, it's an established treatment of kidney failure. It's a curative treatment of kidney failure. All over the world, this treatment is now available. Kidney transplantation in Kuwait, we do almost 80 to 90 cases of transplantation every year. The survival of patients and kidney are excellent after kidney transplantation. To do kidney transplant, we need to have the recipient who receives the kidney and the person who gives the kidney selected and investigated properly. The recipient has to be investigated in detail to make sure that he is fit to receive a kidney and he is fit to undergo all the immunosuppression which we give. That is, you need to suppress the immunity to keep the kidney. The kidney is coming from a different person. So, your body, your immunity or mana has got the capability to reject it. So, to prevent this rejection, you need to give medications to suppress your immunity. So, you should be able to hold this immunosuppression. There are various medications now available which have been much better than the previous medications, which can be less toxic but more effective, which will give a more success to the kidney transplant. With regards to the donor also has to be fit. Ideally, a kidney donor has to be between the age of 21 to 55, preferably the same blood group, and he or she should be healthy and should be willing to give the kidney. So, once you satisfy these 4 parameters, you are a fit donor. So, you will be investigated, the donor will be investigated in detail to look for any systemic illnesses, and if any illness is there, we don't accept as a donor. And giving a kidney to another person is not dangerous for your health. It has been proved now that only 80% of one kidney is enough to live. So, you have 2 kidneys, so the other kidney is a spare. So, it's a God-given spare part. So, there is no harm in donating a kidney to a deceased friend or colleague or relative. It will help him to get a new life, a second life, to survive and then had a good living with the other people. After the kidney transplant operation usually takes around 3 to 4 hours. Before transplant, a day before, we need some preparations. After the transplant, we start the medications to suppress the immunity, and about a week later, the recipient can go home. He will be maximum 10 days, they will be in the hospital and they reach home. The donor, after giving the kidney, can go home after about 3 or 4 days. And they can go back to work after 1 month. The person who receives the kidney usually is fit to go for work after 2 or 3 months. First month, we usually take care very well to make sure that he doesn't get any infections. because his immunity is suppressed with medications. So to do that, it is better to avoid people with cough, cold infections, and then make sure that you take care of your hygienic life. Once you complete 3 months, you are very safe. Once you complete 6 months, you are very safe. You are almost like a normal person. So after 6 months, you can be in the community, you can have a normal life, go to Jamaiya, supermarket, go and you can have attending celebrations, or going to the crowd, they are all permitted. But it is always better to avoid to go to a sick person, an infected person, knowing that your immunity is suppressed. So kidney transplantation needs a long-term care. It's not that once you give the kidney, you are completely normal and then you don't need any care. No, you need to have a complete care of your medications, maintaining your proper health, as I did talked before, do a proper activity and proper diet, and make sure that you avoid infectious environment and to avoid complications. So kidney transplantation is a very successful treatment, and it has to be preemptive wherever it is possible, or after dialysis few months or few years, but it can be done very safely in a given center.